The 50-year-old man left Wuhan, China, the virus's epicenter, on Tuesday, later boarding a 16-hour flight to Toronto. It was on board that symptoms first appeared, though on arrival at Pearson Airport, no flags were raised by officials.
This patient was not reported to us, no.
5 days later, authorities are now searching out and contacting passengers seated within 2 meters of the infected man. On Wednesday, he walked out from here, headed home in a private car, but by Thursday, his symptoms were worsening and his family called 911. That prompted the health system that had long prepared for this moment to kick into high gear, sending paramedics to that home in protective gowns and masks. It would have looked something like this as the ambulance brought him here, Toronto's Sunnybrook Hospital, which immediately put the man in isolation.
The patient will not be discharged until we can be assured that they have fully recovered.
Meanwhile, a passenger from the man's flight tells CBC he was not contacted by public health, so he called them and says he was told to monitor himself for symptoms. He's chosen to self-quarantine for 14 days because he doesn't want to be a burden to society. He did not want to be identified, worried about the stigma associated with coronavirus, pointing out Chinese Canadian children he knows are being bullied and told to keep a safe distance by other kids. The first patient's family is quarantined, though at home. He is in stable condition in hospital. A good reminder that while coronavirus can be deadly, it has only been in a small minority of cases.
We completely understand that there's a lot of anxiety and questions in the general public, and that is very understandable.
The virus is now crossing borders really around the world, a step that health authorities say was inevitable because it's being carried by infected passengers from China. Those health authorities now preparing for the potential next wave, and that is the possibility of human-to-human transmission right here in Canada. But for most people, they stress, that is very unlikely. David Common, CBC News, Toronto.